Okay, let's onboard onto CancerBot and find some good trials. Follicular lymphoma, stage 1. Yes, previous treatment. First therapy was radiotherapy. October last year. Outcome was stable disease. No second line therapy. US 95628. 50. Male. Yes, more diagnostics. And C, 1500. Yes. Okay, so we have some matching trials. This trial is not particularly good. It's a bit far away. It's got a score of 0, actually. Now we have some other interesting trials. So we have a trial that's 14 miles away, right there in Sacramento with us, and it's testing the safety of anti-cancer drugs tazemetostat and belinostat in patients with lymphomas that have resisted treatment. Let's take a look at this, and we can see that it's rated fairly good, goodness score of 50 because it's close, because the risk actually is fairly high, so it doesn't get a lot of positive points for that. The benefit, and these are all on a scale of 20, the benefit is reasonably good, 11, and then the patient burden is 13, so reasonably high. So if we change the weights, we could change this, and maybe if we reduce the distance weight and increase the weight of benefits or the benefit weight of risk, we might get some different trials recommended. But this trial does look pretty good. You can see that it has a whole bunch of attributes that have been extracted from this wall of text, which is very difficult to follow. And all of these attributes are here. We are eligible sort of starting from the bottom. We have the right washout duration. We haven't had stem cell. We have our primary refractory. We've had greater than or equal to 1 line of therapy. No hepatitis B, C, or active infection. Karnofsky score is high enough. ECOG is low enough. We have follicular lymphoma. We were in the right age range. Our ANC is high enough. Okay, now it's asking for serum bilirubin relative to the ULN maximum, and it is 1. We do need to tell it the ethnicity because the upper level of normal does vary based upon the specific ethnicity. So let's go ahead and move to the relapse count. We had 1. We've had no pre-existing conditions, so we don't have cancer, cardiac issues, hepatic impairment, or renal impairment. Platelet count is 90,000. We get similar questions here about liver enzyme levels relative to upper level of normal, and you can see that we actually did. We are within the range. That is right at 1 times upper level of normal. And then we have the EGFR filtration rate is 90, actually in the normal range. And then we are willing to use contraceptives. So we are now eligible for the trial. And then once I click that I'm interested, CancerBot will contact me and go through the burdens of the trial, the phases, and the risks of the trial in more detail before handing it off to the researcher.